What does that mean, and why are they of interest? Thank you.
Morning, everybody. Morning, colleagues. Thank you, Anthony. It's a pleasure to be here. I think in terms of the question that you've asked about short-lived climate pollutants, so we all know that the concern for climate change is a global concern. And it's a global concern because we have what we call greenhouse gases. So these are gases that cause global warming. And the most predominant one is carbon dioxide. But besides carbon dioxide, we also have other greenhouse gases that also cause global warming, but not as prevalent as carbon dioxide. So, and some of them also air pollutants. And I'll probably just mention two which are more prevalent. One is methane. From your basic chemistry, you know methane is one molecule of carbon and 4 molecules of hydrogen, CH4. And the other one is black carbon. Because we're talking about clean cooking, what you must appreciate that both particularly methane and black carbon, methane stays in the atmosphere for a very short period of time, roughly between 10 to 12 years. But the potential that it has for warming the globe is actually almost 70 times more than carbon dioxide. So from the latest IPCC report, the assessment report, 6th assessment report, it's very clear that for the world to meet the 1.5 degrees target agreed under the Paris Agreement, that cannot be achieved without taking action on short-lived climate pollutants, particularly methane. So I wanted to say, because if you lived in a rural area mostly, and also maybe in informal settlements, where most of the cooking is done using biomass, one of the things you see is actually the black carbon, so the soot. So you can imagine, you might see that soot on your rooftops and so on is really black, and you can actually feel it. It's part of the particulate matter. But that also, of course, goes into, particularly for the women who are cooking, it goes into the respiratory system, sometimes also for children, and then that affects their health. So I think why it's important, to go back to your question, is that we pay too much attention to carbon dioxide, and that's important. But in our plans, our climate plans, we don't pay as much attention to short-lived climate pollutants. But if we do that, we will have achievements. One achievement we have is that, as I've talked about, we will reduce the warming, the global warming, so address climate change. But most importantly, if we act on short-lived climate pollutants, we'll actually have health benefits. And then so the combination of health benefits and global warming are very important. As an environment person, there's also another added advantage, because when people cook with biomass, besides the fact that you have short-lived climate pollutants, that biomass comes from vegetation. So it causes deforestation and clearance of vegetation. And so that's why, one of the challenges we have in terms of where our emissions are coming from, is coming from land use change and deforestation. So that would also help us reduce deforestation and help us address issues of reducing emissions from land use change.
Thank you, Philip. What I get is that the short-lived climate pollutants actually contribute to the health of the people. And I think I will pick up from there. And Mr. Rolem, what is the impact of household air pollution on the health of Kenyans, and what is the Ministry of Health doing to address this? I know this, there could be, or you could be taking action from the Ministry of Health. Please tell us what the impacts are and what the Ministry is doing. Thank you.
Yes, thank you very much, Chair, and hi everyone. Yes, as you have been told, I'm Rolem from the Ministry of Health, and in regard to the impacts, we've just been told that it has the effects on our health, and critical in this is especially the respiratory, because we get it. Just say we inhale these gases that come from what Philip has just all the plant uses, or even the household activities or your day-to-day and even moving around. So we inhale the gases, so it has that effects to the respiratory, and that is now the various kinds of chemicals have various kinds of impacts, including even pesticides when we are doing even spraying or now any of the land uses issue. So it directly affects the respiratory, and that is the issues to do with the respiratory infections or conditions, and at the same time the same particles or particulate matter that gets any kind, it forms either it's the short-lived climate pollutants or even more of those chemicals that goes into our systems. They go into our system, including even into the bloodstreams and the cardiovascular system. So they are also responsible for a number of cardiovascular diseases. And this now brings in the issue of being responsible for the NCDs. And globally, environmental factors, which include air pollution, is responsible for around 13 million deaths in terms of disease burden. And in Kenya, household air pollution alone is responsible for over 23,000 deaths per year. And that is like, if you take even from the global point, bring in indoor and outdoor, it's responsible for close to 8 million deaths alone. And the total in terms of the environmental conditions around 13 million deaths. So it's still, they take air pollution being one of the primary driver for climate change, really kills more than the others, even talk of agriculture, talk of transport. Transport is one of them because it's responsible for outdoor, but at least those two are the biggest. And you can imagine, the fact remains that we spend a lot of time, 90% of our times within the household. So I think that's why household air pollution is responsible for over 30% of the disease burden. And Kenya is responsible for over 1 million times that you are sick. They are called the disability adjusted life years, DALYs, and still again responsible for 6% of the disease burden and 8% of all deaths. So it's top 10 in regard, air pollution is top 10 killer in regard, and it is number 1 in regard to primary cause of cancer. Put it together with tobacco is still also part of the air pollution. So this is really a big issue. And there were, WHO had done some kind of profiling in regard to the various diseases, and one of the biggest killers was found from air pollution. One of the biggest killers was cardiovascular disease. And when you go into each of them, okay, women, men are really proportionate in regard to how they are affected, but those who are is also borrowed from the global practice in regard to the World Health Assembly. In the developed world. So what the ministry is doing currently urgently we decided, instead of going into planning, we decided to go direct to interventions. And what we did was to come up with a training guide for our ground level health workers who can reach the Tier 1 health facility. And Tier 1 health facilities project. We have trained over 60 trainers who are already trained, close to 2,600 community health volunteers. We still feel like this is very, very small, because it's only represent 2%, 430 strong community health workers who should be able to now cover all the country. Why are we doing this? We want to promote primary prevention strategies which can be able to really change people's mindsets in order to enhance transition to cleaner sources of fuels, to cleaner technologies, whether lighting or even for cooking, heating, and all the other uses of energy. So, because this is the biggest source of this indoor air pollution. So, we are still on course, and we hope that we will be able to get more of the partners so that we can continue changing the perception of people, so that our people take their own initiative in terms of transitioning to better sources of clean energy. And in this way, we would be able to really put in place mechanism to reduce the 23,000 deaths of our Kenyans that dies yearly from, and be able to also put air pollution deaths to even below not being top 10. So it's something that we are working under the universal health coverage. Yeah, thank you.
Thank you, Rolem. The points I take is that the ministry has recognized the effect of indoor air pollution, and there's an intervention to reduce the number of deaths that arise therefrom. And specifically, I also recognize or note that you said you are trying to create demand for cleaner fuels by you, as a Minister of Health, advocating for cleaner fuels and technologies, and this will go a long way. Now, now we may go to our next speaker, Dr. Mutari. Clean Air Africa is almost a household name in terms of house air pollution in Kenya, almost. What is Clean Air Africa, and how is it addressing the issue of household air pollution in Kenya? Thank you.
Thank you very much, Mr. Eneno. Before I talk about, I say about Clean Air Africa, what it is, I want to say Clean Air Africa was established in 2018. And it was founded at the University of Liverpool, School of Public Health and Policy. That was in 2018. And the directorship remained at that university until this year, when now the directorship is being shared or coordinated between University of Liverpool and Kenya Medical Research Institute. Now then, what is this Clean Air Africa? Clean Air Africa is a partnership of experts, and these are experts from academic, research, and clinical institutions, but in specific countries. It's not all over the countries. This partnership is in Cameroon, in Africa, and Cameroon specifically in the Douare Hospital, Douare General Hospital. Then in Kenya, the partnership is in Kemuri, and specifically in the Center for Respiratory Research, Center for Respiratory Disease Research, and then Moi University, which is a School of Public Health. Then in Uganda, the partnership is in Makerere Lung Institute, and then University of Dar es Salaam. The partnership is in University of Dar es Salaam, but a School of Politics, Political Science and Economics. And then we are also having the partnership in Rwanda, and Rwanda is the Rwanda Biomedical Institute. And what we are trying to do with that one is where we used to go all the way to the United States to have the filters processed. At Kemuri now, we are establishing a center of excellence for air pollution, the only kind in sub-Saharan Africa, where all the countries now will be processing their filters in Kemuri instead of going all the way to the United States. They shorten the journey, and of course the equipment will always be inaccessible. We are launching that facility on the 31st through the VVIP in this country, and we welcome you, of course, to that VVIP. Then of course the other one is where where Clean Africa has been trying to strengthen the community health system, especially the workforce, so that they can pass messages in the communities. Just passing messages alone for information is a very strong tool to make people actually adopt green fuels, because what we learned in the process of working with the communities is that the communities could be having resources, but because firewood is always available, charcoal is always available in small portions, being sold in small portions, they have been using it because they have also not understood between the linkage of the emissions and the disease development. So we have developed a manual with the Ministry of Health and of course other partners, a manual that is very, very clear to be understood by the community health workers, who are amounting to 130 in this country. And that manual has been piloted and also rolled out in the 47 counties, but with small numbers at least to train. But now what we are trying to say is that we want now to support the Ministry of Health in mobilizing more resources so that more community health volunteers can be trained so that they reach the households. And they are going to reach the households not using that manual, but they are going to reach the households using simple messages that are already put into a job. There's a job which is developed that the CHPs will use to pass those messages. And when we piloted these messages or these jobbings through one of our partners, More University, we found them to be very, very impactful, where we found several households actually, despite the economic hardship, they have managed actually to shift very quickly, and they have also avoided now contracting diseases like the cough Rolem talked about, of course, like pneumonia, and some of the especially children who used to have headaches because of carbon monoxide poisoning. So we have found those jobbings, those simple messaging to be very impactful in respect to the change shifting from using polluting fuels to, of course, also improving their health. I think basically that is what I have to say. But if there's a follow-up question, I will pick it up. Thank you.
On the adaptation measures, thank you.
Good morning, everyone, and thank you to our moderator for this opportunity. I'm glad to be part of this panel discussion this morning. Just as my colleague, Dr. Sano from the Stockholm Environment Institute has mentioned, greenhouse. When you talk of climate change, you're mainly focusing on greenhouse gases, and these examples of this are methane. You have carbon dioxide. You have hydrofluorocarbons, and when you talk of air pollutants, you're mainly looking at gases like nitrogen oxides, you're looking at sulfur oxides, you're looking at particulate matter, which is the black carbon. So when you're looking at the link between air pollutants and climate change, you find that in many cases, both greenhouse gas greenhouse gas emissions and air pollutants are emitted from the same sources. A good example of this is the emission from vehicles, which is made up of particulate matter, which is the black carbon, and it is also made up of carbon dioxide, which is a greenhouse gas emission. Another point is some of the substances that contribute to both greenhouse gas emissions and air pollution. Some of the substances that contribute to greenhouse gas.
So not just the short time that we usually spend. If it's going in the agency coordinating kind of committee, the way the Minister of Health usually does what we call the ICCs, you go for 3 days, like you really go and retreat, so that you can really come up with even plans, individual plans for various linked sectors, so that you have targets after the meetings. Because most of the time when we go for the ministerial committee on clean cooking, it's usually like I just tell you what we are doing, and that is it. So I think we need to probably think on how we can strengthen the existing coordination mechanism in such a way that we can be able to be coming to really to bring targets and coming to take new targets during that time that we meet, so that we can be able to really have more value when we have such forums together. But I also would really follow up in terms of also maybe building the coordinating space, especially for health, because when you talk of climate and health, it's now becoming one very big forum that may also still require maybe some thinking of even of talking of air pollution as a standalone TWG, so that you can put the other one at another higher level probably. Thank you.
That sector is extremely very important, but the way we are approaching it in Clean Air Africa is under the Center of Excellence for Air Pollution, which we are launching 31st of January. We are mounting between 1 to 2 months course. We are still developing the curriculum to train journalists on communication, on health, communication and journalism, so that they can be reporting accurately, and so that they can also come up with the stories from the communities on
Thank you very much. I want to just speak to question 2 in regard to the reporting. Thank you, Dr. Mitari, because within the center and especially that kind of reporting, within the center there will also be that tracking of the impact of the work that we are doing, because we would also mount what we are calling the health impact assessment training, specifically on with the interest on the air quality assessment, the energy assessment, so that we can be able to really follow up on how are we moving, and that would also be part of a course that would be essential in terms of backing even the NEMA EIS requirements, because the health sector requires that high risk sectors require to really that is course. But looking at 2018 WHO assessment report in Kenya, it was called Household Energy Assessment Report Tool for 2018. WHO strongly recommended in that report that the energy sectors, environment sectors, and health sectors, when tackling the clean energy strategies, may be important to utilize existing best practices, especially in wash and those in food. Because how the agriculture and Ministry of Health and the sectors really work on the food safety and the food security programming there is that kind of shared responsibilities, and even for the water and the health sectors, there is that kind of shared responsibility where most of the time you will find Ministry of Health is really heavy on software, and the ministry is responsible heavy on hardware. So that is what that report is really building into, and we hope that we will be able to really speak together as we move into real implementation, immediately probably after putting in the key strategies, because we are also working from the health sector to put up a household air pollution strategy. The clean cooking strategy is coming. So probably as we continue coordinating, we would be able to really work so that health can really handle the behavior change communication, because using the community health volunteers or the community health officers, that can easily reach everyone in Kenya, rather than probably everyone doing everything, which may not may at the end of the day be counterproductive, and also may also result into just doing the same thing again and again. So we will be probably speaking so that we can be able to really harmonize how we work. Thank you.
Thank you. Maybe you could comment on what this gentleman raised about that there's a headline. I know you don't come from the Ministry of Energy, but from health point of view, that we are trying to promote the demand for clean cooking. And saying that, what did you say? That,
Yes. Okay, okay, thank you. Because I think we are all aware that it's not just talking of this being a health crisis. It's a health crisis, it's an emergency, and we would really be happy to have all the key sectors, primary sectors, Ministry of Energy, even going that mile to also do or ramp up the advocacy, because as much as the Ministry of Health is also working with the community health, it's still not really reaching everyone. So I don't know, but I believe with what Dr. Mutare has said in terms of targeted reporting, reporting rightly, we may also probably work to ensure that we follow up so that we have energy journalism, health journalism, appropriate reporting, but it's not easy.
We are nearing the end of our discussion. I want to say that the training manual we talked about is available at the Ministry of Health website. Please access it. We are visible there. You'll be able to see what we are doing. In addition, I want to say that we have emphasized on our collaboration, where we need to work together, and in the long run, it is improved health outcomes, improved health, well-being, both for the individual and the family and the community at large. So thank you very much, panelists. We have come to the end of our discussion.